emerging diseases and particularly of viral nature. So we have the readiness and preparedness. We have given a proper report to the government that stating that we need some peculiar organizational framework to implement such activities in Kerala, because the problem we are facing facing with the Ayurveda field in Kerala is that the lack of human resources and the lack of organizational framework to act properly in a public health emergency or any kind of disasters, because we have only we have of course we have Ayurvedic institutions in almost all villages in Kerala, but it restricted to only of a medical officer and a couple of staff attending there. And we also have district hospitals, some taluk hospitals are there, and of course there are three government Ayurveda medical colleges along with some of the private colleges. In total, 17 medical colleges are there in Ayurvedic medical colleges there in Kerala. This is too insufficient to meet a pandemic like this. So we actually need help from the civic society, help from the professional organizations, and all those things. So what we have done in the early April was we have constituted, we have proposed the government an organizational framework in a participatory mode from the people, and and a public-private participatory mode. We have constituted a state Ayurvedic COVID-19 response cell. With that, below that, a regional Ayurvedic COVID-19 response cell that is functioning in the three government Ayurveda Medical College in the southern region, that is the Thiruvananthapuram Government Ayurveda College, and the middle region, that is the middle part of the Kerala, that is at Ernakulam, Thiruvananthapuram Government Ayurveda Medical Colleges, and in the Kannur, that is the Kannur Ayurveda Medical Colleges. And all the districts has the 14 district Ayurveda COVID-19 response cell, below which we have constituted the Ayurveda clinics. Ayurveda clinic means today in each Ayurvedic government Ayurvedic institutions in Kerala is functioning. There is an Ayurveda clinic which acts as the implementation unit for these COVID-19 activities. These Ayurveda clinics these all the Ayurveda clinics have Ayurveda task force functioning with them. This Ayurveda task force comprising of private Ayurveda practitioners, students of Ayurveda, and those who are working with Ayurvedic hospitals, and of course the ASHA workers. And the chairman of the Ayurveda task force is naturally the president of the local self-governed system. If it is a panchayat, that panchayat president will become the panchayat president is the chairman of the Ayurveda task force, and the convener, of course, the convener is the medical officer of the Ayurveda clinics. So with this framework, we approach the pandemic population, and of course, we are able to generate definitely some to improve the penetration, improve the reach of Ayurveda through this activity. So I've just moved through what we have done. So while we are facing the pandemic, as we are aware that it is not that much easy to face a pandemic, because we don't have that much knowledge about. Of course, we have some of the structural aspects of the coronavirus previously had, like MERS, SARS-1, or all those things. And so we have constituted a seven task force, a task force comprising of 7 members, and we have 40 invited experts assembled from different parts of Kerala. And of course, we also had some from outside the state and also from abroad, who are working in WHO and all. So major institutions, we have assembled major institutions, and we have taken opinions of over 300 clinicians, and multiple discussions were carried out. And we also checked the availability of these raw materials for the preparation of these particular drugs in the public sector, because we only have Aushadhi, one public sector manufacturing company is there, that is Aushadhi. So by collecting all the inputs from these clinicians and all, we have prepared an essential drug list. This is particularly based on the Ayurvedic treatises already explain lot of science and symptoms of different types, and we have these documental evidences in the Ayurvedic treatises from Charaka Samhita, from Sushrata Samhita, and it clearly explains some of the symptoms that can be equated to some of the viral diseases. And we have selected some of the key drugs that was key drugs that have been proven its efficiency towards treating this antiviral, treating these viral conditions, viral fevers and all, whether it is dengue, whether it is this influenza, or it is hepatitis, etc., etc. So there are a lot of drugs like that. So we have selected some of the drugs, and we also taken inputs from Chinese traditional medicine. Of course, Chinese traditional medicine and Ayurveda share some of the drugs which are very commonly used. The best example being this glycyrrhizide glabra. So likewise, some of the drugs were also in common. So we have selected all those formulations that contains these possible antiviral candidates. So, and we have created this essential drug list, and we have started our journey against this COVID-19 pandemic. Of course, as we are all aware that we have only limited human resources available, but through this organized approach, we have, of course, till now we have done a pretty good job in this pandemic hit population. Over 1.8 million people received this Ayurvedic treatment so far. We have several programs for this against this pandemic. And the first one being some to mention here. Uh, this is the this is all these are for circulation among Kerala population. So it is in Malayalam. Just I will move through that. This is the Ayurveda clinics that we have implemented in Kerala, and we have an online portal to support the data collection as well as to support the patients who are pandemic hit and who are actually staying in the staying at their home or staying at their CFLTCs or CSLTCs, or staying at their home or staying at their CFLTCs or CSLTCs, or institutional quarantine at the early stage, or CSLTCs, or institutional quarantine at the early stage. So what we in stage. So what we do is we DHS or individuals or more or the instructions how to take the medicines and how to follow some healthy lifestyle and diets through the online system, whether it is a phone call or whether it is a phone call or whether it is a WhatsApp message or WhatsApp videos. We have through this Niramaya portal, that is known as the Niramaya portal. And again, we have the Swastham. Swastham means it is a prophylactic measure for common population. If there is a micro containment zone or a containment zone around a particular infected area, what we'll do is we will address the people around that infected area to immunity. Will give medicines to improve their to protect us to for below 60 years of age. And we have a particular program for the reverse quarantine population, that is the Sukhaisham, that is above 60 years of age. And the major program we were having in Kerala, we have been in Kerala is the Amritam. Amritam means the prophylactic measures that we have taken for the quarantined individuals in Kerala, and it was actually widely accepted in Kerala, despite the lower infrastructure facilities and human resources we have. So this is the Ayurvedic prophylactic strategies for quarantined individuals in Kerala, that is Amritam. And now we have the government also has introduced Ayurvedic strategies against COVID-19 for mild symptomatic patients, that is category A to category B, mild to moderate patients, and as well as patients asymptomatic patients of COVID-19 now can have Ayurvedic medicines, and that program is known as Peshajam. And the first program, we must say that it is the that is widely accepted, and a lot of people are coming, is the Punarjani program, that is the post-COVID care that we have adopted, because Ayurveda is having a lot of medicines that can protect the protect your lung, that protect your vital organs, and that can actually rejuvenate or I'm not saying that the regenerate, but it can rejuvenate some of the pandemic hit organs of your body. And of course, where we are through the observations, we have pretty good observations. We have approached all these programs in a research mode, so we have pretty good data to say that some of these activities really work very well. in Kerala population, and we are in the verge of publication because the government in the earlier stage was not allowing us to publish things because we were in the middle of the pandemic, and now the results actually needed to be verified, and now that verification is over, and now it is ready for publication, and we are gathering the informations, and we are extracting papers out of that. So definitely all these activities will we can have it in some of the journals. So these benefits of the program, when we are looking into the benefit of these programs, we can see that the improved delivery of Ayurvedic services to the public through organized approaches. All these organized approaches actually improve the delivery of Ayurvedic services. Of course, even though the traditional medicine of India is being used by, of course, more than 80%, 60 to more than 80%. Of course, the utilization of traditional medicine throughout life, while we look at traditional medicine throughout even higher, while we look it is best, unfortunately, with the population, but unfortunately we are not aware of it. So a particular infectious disease conditions, the coverage of all those programs largely unaware of it. But this time, this organized approach of COVID-19 activities in Kerala, we got pretty good numbers, pretty good figures for this coverage, the reception of all these programs. So also we have a lot of established, we were successful in establishing linkages that are essential for mainstreaming Ayurveda in public health. There was actually a very good linkage between the local self-government governance and the Ayurvedic dispensaries, which was not there earlier. And great opportunity to Ayurveda doctors emerge as family physicians, because as we are all know that Ayurveda is always Ayurveda, like a traditional medicine, are having an edge in the prevention in preventive and promotional health, and also to prevent these lifestyle disorders and all. So by so actually taking the participatory role in the epidemic management with ASHA workers and with the volunteers in a particular locality, the awareness towards Ayurvedic programs also had increased, and also the reach and penetration of Ayurveda again increased. So statewide networks and prompt communication was also established during this pandemic. So while we are looking into the overall COVID scenario and its Ayurvedic approach towards this COVID scenario, it seems that COVID actually gave an organized framework and organized implementation framework and organized reporting framework for Ayurveda that is essential for a health system to remain in the mainstream. And while some of the data I would like to present here, because these are the coverages of certain programs, and this is regarding the Amritam program. Amritam is for quarantined individuals in Kerala. So this is in the earlier May to July. This is a data we have gathered from the mid of May to late mid of June, mid of July. So we have 1 lakh population, 1 lakh, around 1 lakh people had received this Ayurvedic prophylactic strategies while they were under quarantine, because quarantine was the prime preventive strategy the government of Kerala has adopted at that stage in the year 2020, because people are coming from other countries, people are coming from other states, and we had welcomed them, and we had arranged quarantine facilities for them. Earlier, it was predominantly institutional quarantine. Later moved to home quarantine. And the advantage is that they are coming, most of them were exposed, and they are coming to the quarantine, coming to their quarantine rooms. And some of them have, of course, received Ayurvedic medicines, and some of them had not received Ayurvedic medicine. So it was much easier for a comparison, what were the positivity rate in both of these groups. So regarding the coverage, you can see that the Palakkad, 51.6% of those who reached the quarantine uh, uh, for COVID-19 quarantine at Palakkad received Ayurvedic medicine. This is actually the highest for any programs ever conducted in Ayurveda in India also, because when we move through the literature, nothing shows like this. So in the Thrissur 38.4, the red stands for the Kerala, and you can see that 25.7% of those who had reached this quarantine at that period in Kerala. It period has been mentioned here, that is 21st May 2022, 8th July 2020. Actually, 25% of them had received Ayurvedic prophylactic strategies. So we have conducted an evaluation, because we know that the data is available with the DHS, the site of the DHS, and we have gathered the total quarantine data, number of people quarantined in Kerala, in each district, from the Jilla Collector's Office, district collector's office, and also we have collected, and also we will be able to collect that data from the panchayat itself. So the total quarantine data is available, and we exactly know out of that total quarantine people how many received Ayurvedic prophylactic strategies. And we have checked this positivity rate from both of these groups, and you can see that the COVID-19 positivity was comparatively low. It is almost 4.7 times lower when compared to the group who had not received the Ayurvedic medicine. That is, it ranges from 1.35 to 1.61, and it ranges from 0.3 to 0.3 0.4%. Of course, there are certain confounding factors. Certain confounding factors. This doesn't mean that we need to evaluate further. So this doesn't mean that it is prevention, because the best strategy at that time was, if you have getting some of these symptoms, you have some of these symptoms while you are in the home, you are getting some of these symptoms recorded while institution 19. Minor, they were never went out for a testing. So this is the test positivity when compared to the group who had consumed Ayurvedic medicines, and those who had not consumed Ayurvedic. This observation is over 3 lakh quarantine individuals at that time, out of which around 1 lakh took Ayurvedic drugs. And again, we can see that there is the number of symptomatic individual among Ayurvedic prophylactic. So we have also followed around 577 individuals who had turned positive for COVID-19 from the Amrudam Ayurvedic drugs and Ayurvedic drugs. And when we look into the asymptomatic to symptomatic ratio, the symptomatic to symptomatic ratio, the symptom pricing element is there, that it ratio, the correlation, the correlation. So when that means so when we look into the symptom and there is a positive correlation exists, that is there is a dose response we can establish here in this and that correlation is there. So that is another thing I just need to mention here. was our another program, a post-COVID program. Actually, what we were doing is we received the patients. The patients will reach to us once they have completed their COVID management at any COVID hospitals or at any treatment centers. After that, they have 7 to 14 days of quarantine. Some earlier it was 14 days, and later it was reduced to 7 days. And they will come forward for Ayurveda treatments. They will be enrolled into this Punarjani, and they will be followed up for 3 months. And actually, we have reported to the government. We had this program started as early as April 2020. So we were following all these COVID-19 patients, and we have actually the Punarjani report. The report on Punarjani carries a comprehensive symptoms that appeared in COVID-19 appeared as COVID-19 sequelae. All the COVID-19 sequelae appeared in Kerala. That was the first report given to the government, available with the government. That is the report we have submitted to the government. So while we are looking into the COVID-19 sequelae, we can see that almost 93% of the COVID-19 individuals who had this COVID-19 sequelae, some sort of complications or some sort of ailments after the COVID-19, they have recovered within one month period, and the remaining actually the remaining were free of any sorts of symptoms within 45 days. And actually 0.9% of the individuals actually sort of some sort of respiratory features persist. So that was and there was not and that also we could see that also were relieved within 60 to 90 days. Very few, one or two individuals still persist some of the symptoms. And that symptoms, something like the long COVID, incidence of long COVID was comparatively very low in those group who had come forward to take Ayurvedic medicines. So sequelae was cured completely in patients experiencing normalcy. But we have observed one thing that is so important in post-COVID conditions, because even though individuals reported that they have completely cured and completely cured, and they actually feels that they were experiencing their normalcy. But in 7.4 percentage individuals, they admit that they admit that all the symptoms they had with this COVID-19 post-COVID sequelae were completely relieved, but they fail to experience normalcy. They still feel that something is there, and they were unable to identify what actually it was. So this is the condition that persists in some of the post-COVID individuals. So now 0.6 percentage only partially cured, and sequelae was not cured at all in 0.3 percentage. So this is the statistics here. So what could be the how this Ayurveda, like traditional medicine, is benefiting all these things? So I have just explained that we have selected these drugs from the written documentation in Ayurvedic treatises. So all these Ayurvedic treatises, actually, it is the collection of observations of a period, because they have experienced this, they have observed these symptoms in populations, in symptoms in a community around them. The previous Vaidyas were observed these communities around these symptoms around these communities, and they have selected certain plants, and they have administered these plants in this for this particular fever kinds of things, and that was relieved, and they have written it. That is the so these Ayurvedic treatises, majority of the Ayurvedic treatises now, World Health Organization is also telling that it can be taken as a documental evidence for the safety and efficacy of that particular drug. So we are taking for this, because immunogenicity is one of the major direction, and of antiviral activities of the major direction. You might be heard about this Andrographis paniculata. Andrographis paniculata is one of the major major ingredient of some of our Ayurvedic formulations, and it has very potent antiviral activity drugs. So that perspective, if you want to take that perspective, that is also there. And Glycyrrhiza glabra is having that activity. And of course, Mycorrhiza curova, the studies of Mycorrhiza curova with some of the hepatitis viruses are also there. The way in which it is covering the receptors, making it difficult for virus to bind better. So several bioactive compounds aimed at multiple targets. So this is how Ayurvedic drugs. Some of the recent papers telling that how Ayurvedic drugs contains a lot of bioactive compounds. Because majority of them are of polyherbal origin, or even if it is a single herb, it contains a lot of phytoconstituents. So it is acting multiple targets. So that also favorable for these kinds of conditions. Maybe, I don't know, because we have to conduct some mechanistic studies of all these plant materials and all. So regenerative potential of Ayurveda, because Dr. Srijit is also, we have some certain collaborations with Srijit and some other institutions to study the regenerative potential of Ayurvedic medicines and all, like Rasayanas. And supporting evidence from Chinese medicine is also available, because they also conducted certain clinical trials on all these things. But unfortunately, these are community level observations which we cannot convert into clinical trials and all. Definitely, it will take some time. Before that, we have to go for some translational researches, and presently we are trying to form a translational hub for transdisciplinary hub for translational research in Ayurveda, because Ayurveda is a medical system, and the persons qualified in Ayurveda is mainly doctors. So in order to screen these Ayurvedic formulations for potent biological activities, and whether it is anti-corona activity or antiviral activity, that exactly needs, that definitely needs some state-of-the-art instrumentations and state-of-the-art instrumentations and like trying to assemble a group of skilled professionals, and also some of the pioneering institutions. I think ISER Thiruvananthapuram is coming forward to for collaboration, and we are happy with that. And CSIR Thiruvananthapuram is also there, and of course Sudhakaran sir was giving us a lot of inputs, and of course Srijit and the regenerative team also coming. So I invite all the scientists in India and all the scientists in Kerala to come forward to have certain translational research in Ayurvedic medicines, because we have lot of drugs in the Western Ghats, and majority of the and a good fraction of them we are having it in Ayurvedic formulations, and the utility and its therapeutic indications are well documented in Ayurvedic textbooks. So now we know that the vaccination drive is already there, and still the people are dying. Of course, we are unable to extend the coverage. Of course, vaccines are definitely will protect. It's a protective mechanism for these viruses and all. We also admit that. But this vaccination drive to a larger population, of course, definitely, it takes some time, and we also have these threats for mutations into spike proteins and all. So all we have to do is we need to protect our population with some of the immunogenic mechanisms, or definitely we also need some of the antiviral drugs, whether it is from Ayurveda, whether it is from homeopathy, whether it is from Siddha, or whether it is from conventional system of medicine. Definitely, everyone should work together to find a true solution for this. And of course, all these results in the past also, it never came from doctors per se. It came from basic scientists, it came from biologists, it came from chemists. So I think a transdisciplinary approach is, of course, necessary for a permanent solution for this. And of course, the government of Kerala is working on this transdisciplinary, and we are moving forward to have certain anti-corona activity evaluation of some of the Ayurvedic formulations that we have been using in all these programs we have conducted in Kerala. So these are the objectives, translational initiatives to facilitate, support, and guide translational initiatives in Ayurveda.